the thing that I like most about it is that people talk about cancer now, and that there is an openness about it. And it is very important because breast cancer is still the #1 cause of death for women in their 40s. And it is also the #1 feared female cancer. So I think the more awareness, the more you can put it out there, the more helpful we can be to everyone.
I think awareness is the message, is that we can't stick our heads in the sand. If 1 in 8 ladies gets breast cancer, then we need to be aware that if our body's changing, I mean, we don't, even if we don't do self-breast examination, we shower, okay? And if there's something different that you're noticing, and if there is, then bring that to the attention of somebody, your doctor, your best friend, someone that's going to bring you to where you need. Get your mammogram. Once a year, your mammogram should be done. There's a lot of sense right now of when the appropriate time to get a mammogram is. Is it 40? Is it 50? The American Cancer Society, and I agree with them, still says start at 40 and then every year throughout your lifetime, really, to get a mammogram annually.
I think the main point I would want to make is mammograms pick up most breast cancers. Get the mammogram. There's been a lot of misinformation about mammograms, and they are the most important tool that we have to detect breast cancer early. And the other message is that we're not powerless against breast cancer. There are things that we can do to reduce our risk. And a lot of the risk factors are modifiable, like what we eat, how much we exercise, how much we drink, things like that. So there are things that we can do to be healthy and minimize our risk.
There's a lot of controversy about mammography, but they also changed the screening recommendations. So patients are living with their disease and living beyond their cancer. And I think before they would kind of see that word cancer as a finality, and now it's kind of like, okay, I have this problem, I'm going to deal with it, but I still have a full life ahead of me.
Early detection is very important in getting your mammograms every year. Talking to your doctors if you may have risk factors that you're concerned about, such as a family risk of breast cancer that may prompt different screening other than a mammogram, or in addition to a mammogram, I should say. Taking care of yourself is very important. We are in some control of what we can do. So lifestyle factors that can help change our risk factors, very important, and we can't ignore that.
Get your mammogram. That's the most important message. Unfortunately, there's a lot of controversy nowadays about who should be getting mammograms, but at the end of the day, if you find breast cancer early, it's a very curable disease. And you can avoid a lot of the toxic chemotherapy, additional treatments that you may need. So catching it early is still key.
Go for your screening exams, get checked. It takes an hour of your time, just get checked.
So if you haven't had a mammogram and you've been thinking about it, we have free screenings. Once a year we have a free screening. We have mechanisms to do it even if you don't have insurance. So an annual mammogram and being aware of your breasts. And then don't be afraid to bring it in. You know, don't put your head in the sands, because we can cure breast cancer.
I don't know what prevents people from coming in, but we're here with open arms. And never let fear kind of get in the way.